Every surgeon has his own technique and is skilled at doing one thing, and as long as you can get good grafts, it doesn't matter which one we use. However, there is a theoretical advantage to the motorized FUE system, and it's very easy to explain. Now, when you do the motorized, what happens is, first of all, for the rotation, you don't have to use your arm force in order to rotate the punch. In the manual punch, you have to use your arm force or your wrists or your fingers in order to rotate it. And when you do this thousands of times, it causes fatigue. However, with the motorized FUE, you don't need to do that. You just hold the handpiece still, and the motor does the job. Of course, fatigue is not just a problem of the surgeon. When there's fatigue, you're expecting to start extracting worse and worse. The other thing is, and it's probably even more important, is the control in rotation axis, and that's what I would like to emphasize. Now, when you can try it on your desktop using a pen. When you hold the manual punch and you rotate with your hand, I will exaggerate just to explain. What happens is, with the movement of the finger, as you have a look at the rotation, no matter how good you do it, the axis of rotation wobbles. Because the hand is not symmetrical, no matter how skilled you are, there will always be a wobbling, although not as obvious as I'm just showing you now. Whereas when you do it in the motorized, because you are not rotating it with your own hand and the engine is doing it for you, you just keep it at a straight axis, and all you have to do is just penetrate. And the motor does the rotation for you. So the wobbling of the manual punch, should theoretically cause more damage and more transections to the hair. Of course, the better you get at it, this will decrease, but there's still the theoretical advantage of the motorized one. Another, maybe last one that I would say is that when you penetrate with the manual punch, you have to apply some force of penetration to the skin. Now, when you press on the skin, you will see that an indentation can be observed on the skin surface. Now, when that happens, the directions of the hairs on it will change with the pressure. So, theoretically, the best extraction is when the punch penetrates the skin without putting any pressure on the skin. So ideally, you would like to have a very sharp punch that penetrates into the skin, just like cutting through butter, where it does not have to change the surface of the skin, changing the direction of the hairs. So that's another advantage to the motorized over the manual punch. Okay, so having said that, does the manual punch have any advantages over the motorized? I think it has just one advantage, and that is actually an indirect advantage. The motorized punch has unfortunately led to many technicians quickly learn doing extractions, FUE extractions, and has led to the spreading of technician clinics worldwide. So instead of the surgery being done by a surgeon, it's now, especially in Turkey, it's now being done by technicians. Now, because the manual punch is so much more difficult to do, it's limited the number of technicians that try to do this. So there are less technician clinics that will use a manual punch. Now, obviously, this is not a direct advantage of the manual punch, but it's an indirect one. So summing up, if one was to start from scratch and try learning FUE, it would be much easier and practical to start learning with the motorized punch in order to get good and healthy grafts with the least tissue damage. And as usually happens, a lot of instrumentation and techniques in the market are used as marketing strategies for those clinics that is used. And you may hear the opposite of what I'm saying, but these are just facts. And mentioning this, I'd like to take this opportunity that I am not for or against any instrumentation or method. If someone proved opposite to what I'm saying, tomorrow I would change my technique and my instrumentation. In fact, I have this manual punch in my office, and from time to time I take it out and kind of experiment it to see in various situations if that would give me good graphs or not, but until now it hasn't. So that's mainly what I would like to say about the motorized versus manual FUE.